Okay, our next paper is Denise Murphy from Ireland, a survey of metabolic indicators in Irish periparturient cows transition period.
Good morning. I'd like to thank the organisers for giving me an opportunity to present this paper. And I'm presenting this work on behalf of myself and my colleagues in Athlone and Kilkenny Regional Veterinary Laboratories. So the title of the presentation is a survey of metabolic indicators in Irish periparturient cows. The transition period has been defined as a period from 3 weeks pre-calving. 3 weeks pre-calving to 3 weeks post-calving. And this is a hugely important period characterised by significant changes in the endocrine status of the cow, with the rapid mobilisation of somatic energy and protein reserves due to a reduction in feed intake when nutrient demands for the developing fetus and the upcoming lactation are increasing. So every year in the regional vet labs, we receive samples from veterinary practitioners requesting metabolic profiling for cows in the transition period, but there wasn't a defined package on offer to them, and the results were never collated or analysed in any way. So in the spring of 2015, and again this year in 2016, Athlone and Kilkenny regional labs conducted a transition cow survey within their catchment areas. So just here on the map, we're currently here in Dublin, and Athlone is in the Midlands, and Kilkenny is in the southeast of the country. And the catchment areas would be approximately 50-kilometre radius of Athlone and Kilkenny. Most of the bloods would have been collected within a 50-kilometre radius of the two labs. So between January and May in 2016, 810 blood samples were collected in batches of between 5 and 15 bloods per herd from cows that were in the transition period, and they were from 101 different herds in 2016. And the previous year we collected over approximately 750 blood samples from, again, between 5 and 15 cows per herd, and there were 92 herds involved that year. So basically, these are the metabolic parameters and the reference ranges that we used for the survey. So we looked at serum magnesium, serum calcium, inorganic phosphorus, copper, urea, non-esterified fatty acids, beta-hydroxybutyrate, and glutathione peroxidase. We suggested that we would just analyse the calcium in those bloods that were indicated to be within 48 hours of calving. But in reality, I'd say there were lots of them outside that window. The reference ranges we used are the reference ranges that we use in the veterinary lab service here in Ireland. You can see there, for example, for NEFA, it's quite a broad range. It's 0 to 1 millimoles per litre. And that's what we're using for this analysis because we don't have information on whether they were pre-calving, whether it was the day of calving, whether it was a week after calving or 3 weeks post-calving that the bloods were taken. So it is quite broad. When we would be reporting these, we would advise that, for example, like by 7 days post-calving, you would expect NEFA values to be less than 0.7 millimoles per litre. So this graph represents the results at a herd level. So this shows the percentage of herds where at least one animal or one sample, the serum concentrations were outside the reference ranges. So you can see there's quite a significant percentage of herds had at least one animal with a low calcium. You're looking at 66% of herds there. And also 55% of herds had at least one blood sample where the magnesium levels were below the reference range. So, leading on from the previous speakers, that represents a significant potential for problems with both clinical and subclinical hypocalcemia and hypomagnesemia, and all the related periparturient diseases that were mentioned earlier, like ketosis, retained placentas, slow calvings, calves that are slow to suck and get going. In addition to that, then there's the low urea was. We found low urea in at least one sample in 55% of herds as well, which again is quite a significant percentage of herds to have evidence of low protein in at this critical period. A low copper was seen in a similar percentage, just about over 50% of herds had evidence of low copper. That's not unusual in Ireland. It's a pretty widespread problem. The low phosphorus was seen in about 38% of herds. And this possibly relates to the decreased use of fertilisers, partly due to the EU Nitrates Directive, but also probably for economic reasons. There's less fertiliser being used, and while obviously high phosphorus can lead to complications for hypocalcemia as well, it may be that things have shifted too far the other direction. High BHB was seen in about a quarter of the herds, and high NEFA in 31% of herds. But as I say, given the reference ranges you're using, that's probably hard to interpret much about that there. Except, like, I suppose to say that even allowing for a cutoff of 1, if you've got 30% of herds having cows with values over 1 millimole per litre, it's likely that energy levels are a significant problem. The other thing I would say about the NEFA analysis is that, like, these bloods would have come in the post. They certainly weren't sent on ice, so there's those kind of considerations as well when interpreting the values. This graph just shows the results on a sample level as opposed to a herd level. So you can see there again, like, low calcium was seen in a third of samples overall. So it's not, we were seeing more than 1 in most cases. You were seeing several samples from a herd that, where it was an issue. It was multiple samples were showing up with the low levels. And then magnesium and copper was about 20%, and urea similarly about 20%. You're down at about 8 or 9% for the percentage of samples that had high BHBs and high NEFAs. So just to kind of reiterate the key findings, I suppose the high percentage of herds showing low serum calcium and magnesium was the big thing because of the huge contribution that they would have to both clinical and subclinical hypocalcemia, hypomagnesemia, and the related periparturient problems. Low urea obviously reflects inadequate protein in the diet. There is a slight, there was high urea in quite a few samples from the Athlone area, and I'll discuss that further in the next slide. The high BHB obviously indicates excess circulating ketone bodies and mobilization of body fat. And the high NEFAs, it would indicate negative energy balance, as mentioned previously. As I say, the high percentage of herds with low serum copper is not uncommon in Ireland, and you'll see from the next slide that it is there's regions of the country worse affected due to the type of land. The bogland would have lower copper levels or higher molybdenum levels. So this slide shows that there's quite significant differences between the two catchment areas. Basically, you can see there that the low calcium levels. It was a very significant problem in the Kilkenny catchment area, where you had 85% of herds having at least 1 sample with serum concentrations below the reference range. Also, you can see that the low urea was a big problem in Kilkenny, with over 60% of herds showing evidence of low urea, compared to about 20% in the Athlone area. The reasons, I suppose, are to offer a possible explanation for this. The pasture land in the Kilkenny area would be better quality than in the Midlands, and there would be a lot more intensive dairying in the southeast of Ireland, in counties like South Tipperary, Kilkenny itself, Waterford and Wexford. There would be quite intensive dairying enterprises there, larger herd sizes, more dairy expansion. There also is likely to have been maybe a push for more a grass-based diet, maybe not enough concentrates being fed, and also the application of slurry would be quite common, and probably more so in the more intensive areas, applying the application of slurry to silage ground in the spring, which has an effect of increasing potassium levels in the silage, and grass-based silage would be the predominant dry cow diet in Ireland. So that probably does explain the differences in the regional differences. Also, you can see the low copper there. As I say, the Midlands, the land wouldn't be as good around Athlone. There is a higher percentage of bogland, and molybdenum levels would be higher in the Midlands than in the southeast. You can see as well there's a high urea there. Whether you can tie that into the fact the high urea in the Midlands, whether you can tie that into slightly higher levels of BHB and NEFA, it might be over-interpreting the data, to be honest with you. But obviously you need, if you don't have, you need energy to utilise the protein in the diet. So there may be a tie-up there, but it's probably a bit much to over-interpret it. This graph just shows briefly the data from 2015 compared to the current year, which is what I've presented to date. And as you can see, there's very little difference between the two years. Slightly more cases of low calcium, or more incidence of low calcium this year than last year, and the magnesium has reversed. But there isn't a lot to say about that, really. So in conclusion, I suppose, just to say that blood biochemistry profiles are a useful tool in monitoring and management of transition cow and investigating performance-related problems in conjunction with other methods like body condition scoring and analysis of milk protein percentage and such things. Many Irish herds have indicators of suboptimal nutritional management of transition cows. There are significant variations in the results there for the different regions, and probably more to do with the intensity of the dairying enterprises in the two regions. But there is certainly value in using metabolic indicators to monitor herd health in cows in the transition period. So finally, I'd just like to thank the laboratory staff in Athlone and Kilkenny Regional Veterinary Laboratories and in the Central Veterinary Laboratory in Backweston for actually conducting the tests, and to thank the participating veterinary practitioners and herd owners for their cooperation. That's it.
Thank you very much. This paper is open for any questions. Just come in with a microphone. Just down here, please, next to pillar.
Can I just ask Denise if the data are for herds that were clinically normal, or were they under investigation for some transition period problem?
To be honest, we wouldn't know that as such. Like, we offered this package, this transition cow package, to practitioners to advise them to use it in the transition period. So some would come in with maybe a history of, like slow calvings or something, but several of the blood samples would just be routine profiling, just as part of a herd health thing. So they weren't really, they weren't from it wasn't essentially problem herds that we were getting them from. It was across the board, really.
Any further questions?
Tom Comerford, Tipperary, Ireland. We had a massive problem this year with phosphorus deficiency in Tipperary, where cows got red water, died, and indeed to this very day they're eating stones. When you do rectals, you come out with stones in your hands. Why is it so common this year, and what is the best way to deal with it?
Well, to be honest, I suppose I don't know if it was any worse, like looking at the data, than last year, but like that, I suppose you'd just be surmising that it's probably, that there's a deficiency in pastures. That basically, I think Tagus would tell you that the amount of fertilizer being used on farms has decreased, particularly phosphorus, and soil sampling has gone way down as well. So I'd say farmers just don't have the information, or don't know whether they're phosphorus deficient or not. And I suppose the other side of it is, if you overdo the phosphorus, then you're running the risk of getting into complications with hypocalcemia as well. So it's a delicate balance. I think there is huge variation even within farm. So soil sampling is probably the way to go to try and get a handle on it. If a farm has a particular problem, get some soil sampling done and see what the levels are on the farm, and take your supplementation from there. Because I suppose just willy-nilly going in with phosphorus might be a bit of a dodgy business if you don't know your levels to start out with. about it.
Okay, thank you very much, Dr. Murphy.